Hello and welcome to this coffee and chat with me, Hannah Bryce, clinical animal behaviourist and trainer. Today I'm delighted to speak with Dr Carys Sonnenberg, who's a fantastic doctor and menopause specialist, and he's helped me with my hot flushes, my brain fog and a whole lot more when I was diagnosed by Carys as perimenopause. I've asked Carys to join me today to discuss hormone replacement therapy, or HRT, what it is and what does it have to do with our animals. And that's because recently there's been a number of cases reported in the national press where dogs have been exhibiting physical or behavioral changes, and it's been found that these changes are due to their owners and carers taking HRT, and it's been transferred to their pets. Yet my investigations to secondary exposure to HRT onto our animals is really lacking, and there's a general lack of awareness as well to the risks. So I've written an article about this and invited Carys to explain more about HRT. So thank you, Carys, for joining me today. I really appreciate it.
It's my pleasure. Thank you for having me.
Can you give us a very brief introduction to hormone replacement therapy, its primary uses in the context of menopause management?
Absolutely. So hormone replacement therapy is usually given to women when they are going through the perimenopause and menopause, and it is used to help ease the symptoms that we can experience at this time. We usually replace the hormones estrogen. We may replace progesterone, and we may also use testosterone. So there are three hormones that we may be using at this time in order to balance ease the symptoms.
So can you tell us a little bit about the different types of treatments and why some forms are preferred over others?
So when we're giving the estrogen, we may give it through the skin as the form of a little gel, or as a patch stuck onto the skin, or as a spray sprayed onto the skin, and the estrogen would then absorb through the skin into the body. It may also be taken as tablet form. Progesterone can be used as well, taken as tablet form, or maybe in a little Mirena coil, or as part of a patch. And testosterone can be given in women off license as part of a little gel, in a 1% or 2% testosterone gel, and that's absorbed in through the skin. And we individually assess each woman to decide which is the safest preparation for her.
Okay, and there are different application sites, from my understanding, when it comes to the topical solutions. Can you tell us where those sites are, and what that then entails in terms of possibly the risk around it?
Absolutely. So when you're using an estrogen gel, there are two types of preparation. You can either have it in a little sachet or in a little pump dispenser. So you dispense the pump onto the hand, and then, depending on how many pumps you are using, you would rub it onto your upper outer arm, or onto your thighs, avoiding the breasts and the genital area. And you would leave it to dry for between 2 and 5 minutes. You should then avoid exposure from contact with other people for about 2 hours to let the gel sink into the body, and avoid washing within an hour. So this is the case for the estrogen gel. With the spray, the spray sprays onto the forearm, dries in about 67 seconds. And again, you need to avoid washing the area for about an hour afterwards. So it takes time for these gels to sink into the body. The patches are applied usually to the buttock area, but people can put them on the tummy or on the thigh, so they can be put anywhere that's not near the breast and not near the genital area. And the patches absorb estrogen gently into the body over the period of time they are stuck well to the skin. The matrix patches can release estrogen for maybe up to a week. So although they are replaced twice a week to make sure you have steady levels of hormone in the body. So if we're looking at absorbing it through the skin, you're going to be using different parts of the body, and depending on what your preference is.
Yeah, and of course there's oral as well, isn't there? There's some
you can take an oral tablet, and that then goes into the gut and is absorbed into the body. So all those types of HRT, so hormones, so the estrogen and the testosterone, are absorbed into the bloodstream. And making sure that when you've applied any sort of gel, you wash your hands afterwards, because the 17 beta estradiol, which is a body identical estrogen, is present actively in the gel. So if you don't wash your hands hands, there is a risk of transference to another person, maybe your partner, maybe a child, or maybe a pet. And particularly if you're having close contact with someone on your arm or your leg, within a couple of hours after using the gel or applying the gel, you may find that there's a transference of active hormone to that person or to that pet. And there are some studies that we have both been looking at, which just can confirm how long it does take to actually absorb the estrogen into the body, for example. And we know that if you apply estrogen gel to the body, and if you have a shower within an hour afterwards, we can see a reduction of about 25% with absorption of that estrogen into the body. So the estrogen is absorbed into the layer of the skin, and then it takes time to go into the body.
Yeah, and of course, if we think about, let's just say it was a dog licking the owner, and they've got that topical solution on there, that gel or that spray, that 25% that's gone down the shower drain could be that 25% going in and being absorbed by that animal, which is why we're seeing the secondary exposures. Before we kind of go more into that, I just wanted to just ask, why do we particularly put some of these sprays and gels in the areas that our pets may want to kind of lick, which is like our arms and legs and things like that?
It's interesting, isn't it? I suppose that's because we don't want to apply it near the breast area and near the genital area. So these are areas of exposure that that are easy to apply to. They dry easily, and with patient preference, we can see them being used more easily. But again, maybe in the summer, if you're wearing shorts and t-shirts, you're more likely to have that area uncovered afterwards. So if you sit cuddling your child, cuddling your pet, have close contact to them really quickly after applying the gels, then there is going to be risk of transfer of the active hormone estrogen and of testosterone.
Yeah, and that was the thing that you mentioned, that really it was a story in the national press a number of months ago that made me think, gosh, this really isn't talked about, not even in the instructions for a lot of these treatments, in my experience. And then I started asking others, peers of mine who are also on HRT, and it was something they weren't aware of. So, you know, I then started looking at the data around it, which has led me to produce this article, which has more information, and then approaching you to say, you know, what's your experience as a practitioner about the secondary exposure risk? And you've mentioned children, and there are studies, quite a few studies, aren't there, around the children? But then you mentioned things like, think about your partner. If your patch falls off and it sticks to your partner, or even your animal's paw, you know, and so we can see some real changes. And just some of the changes that have been recorded that you were talking to me about with children are changes in appearance and things like that. So if you don't mind just sharing some of those experiences, that would be great. And then we can see parallels with the animals, and we'll talk about that in a sec.
Absolutely. So if you're looking at estrogen exposure in a young child, you could be, and they're consistently exposed to the estrogen, that you may find that you are seeing signs of early puberty. So breast development, for example, pubic hair development, maybe some bleeding, accelerated growth. If you're looking at testosterone, the side effects of testosterone can be excess body hair, changes in weight and appetite. You may find acne, increased hair on the skin, greasy skin, and in changes in the size of the genitals, and deepening of the voice. So those sorts of things are always possible. And we have to be very careful with application, because sometimes people apply the gels, the little sachets of testosterone gel, for example, should be applied over about 8 to 10 days if you're looking at applying 5 milligrams a day. But it's important to be very clear when you're explaining to people how to use these gels, because some people don't apply them correctly. They may apply the whole dose at once. Right. And then if somebody is having contact with that, they're more likely to absorb more. So we've got to be very careful to make sure we're really clear with prescribing, and that we do give this advice about, you know, definitely wash your hands, keep the area covered, and watch your pets and watch your children.
Yeah, and we see parallels in terms of the obvious signs that you just mentioned. You've listed, you know, kind of precocious puberty that we're seeing in these very young children. And there's evidence to show that in the animals we're seeing, regardless of whether it's a male or female dog or cat, we're seeing enlarged mammaries, we're seeing hair loss with some of them, whereas with the children you're seeing pubic hair developing, stunted growth depending on the hormones that the animals have been exposed to, excessive vocalization, restlessness, humping, the list goes on. So, you know, you've given some really good advice already in terms of caution about hands and things like that. And can I just confirm, as a rule of thumb, you're saying, you know, give it about 2 hours if we're using some sort of topical spray or gel or anything like that. Is that right?
Yes, from the evidence that I have looked at in the articles that I've looked at, it seems to be that within 2 hours we need to be very careful with close contact with others. It's really difficult because we all absorb estrogen very differently through the skin. So some people absorb it very, very badly. So it really isn't the right treatment for them. And other people absorb hormones very quickly through the skin. So I would suggest, and from what I've read, the evidence says about 2 hours.
Yeah, okay, great. And that, you know, goes beyond just thinking about stroking your pets or cuddling your young child. It could be just the fact that your pet likes to sit in your lap for prolonged periods. And if we think about hairless dogs or cats, the risk potentially could be even greater because they haven't got that barrier of fur. Just coming back finally to the oral HRT, again, it's just like we will with any tablets, isn't it? Having good environmental management, keeping it out of reach of little hands and paws and things like that.
Absolutely.
Yeah, exactly.
And making sure that if anything's, you know, that you're not, if you're leaving it around, that that it's actually in a high cupboard, so you're using sensible application for medication. Because there are products that are oral HRT, there are also vaginal HRT creams and little tiny tablets that can be easily lost. If you drop one, it's hard to find, although they're very low dose estrogen. I think any medical application needs to be kept well away from pets. And when you're taking off a patch, make sure you seal it completely and dispose of it in the bin straight away, rather than leaving it around where it could become attached to a child or to an animal or to a partner. So I have had experiences, I think we were talking about, where people have woken up in the morning and the patch isn't on them, it's on the partner. So it wasn't great for them, but yeah, so it's being really careful that that you're just being sensible with the product and careful with it.
Fantastic advice. Thank you so much for giving up some of your precious time to speak today with me about this subject matter. If any of you have been watching this and want to learn more about some of the signs that could indicate that your animal has had secondary exposure to HRT, if there is an HRT user within the family home that's coming in close contact with your animals, do check out my article that's on my website. Carys's website details are also on there. So there's lots more information, plus some advice for behaviourists and veterinary staff for questions that you might want to consider when talking to your clients if you suspect that there might be something more than meets the eye to the behaviours and the observable signs we're seeing with those animals, and we can't quite work out what could be going on. Thanks again, Carys. Take care for now.
My pleasure. Thanks for having me.